Well, what you're going to hear today is little unabridged comments that we picked up on, and really with all the changes in healthcare. Today you heard the rules, what's happening. It's going to continue to change. But really at the end of the day, we have to comply with this stuff no matter what. What's going to change the outcome of your healthcare costs? And this seems to be the subject that is on everyone's mind, and what's the right way to get at it and what's going on. So let's start here. Let's assume that today, based on what we know, that employers have three basic options. One, they can stay the course, and that's that legacy broker carrier model that's been doing so well. Or you can send all your employees to the exchange, that's the Obama model. Or you can realize that it's time to change. And you need to start collaborating with your employees to actually change healthcare. So here's a question as I go through some thoughts. Ask yourself this: is your company improving your plan members' healthcare costs without changing the carriers, reducing their benefits, or increasing their deductibles? Have you been able to do that? Secondly, do you have proof that whatever strategy you are deploying is actually working, that you're reducing your costs through member and spousal claim improvements? Yes? No? Third, are your members and spouses making the right healthcare development choices? Or are you just holding the bag on it? You're just willing to continue to pay? I don't know. Do you have a healthcare reporting system that has some kind of capabilities like your accounting systems do and other reporting systems to show you whether or not you're actually capable of managing your system? Well, when you look at this, you ask yourself the question, how's it working for you? You know, this is 1999 to 2012, and the expectations, you know, it's not going to stop unless something changes. If the rest of your products went up in cost, what would you be doing if it was matching that type of increase? It's tough. Well, Time Magazine just came out with a heck of an article, and yet they want to blame the entire system out there. But what's interesting is that if you really understand what's happened with healthcare, they've asked for alignment. The hospitals have their requirements. They need to help the communities get healthier. But the employers aren't aligned with that. They've got plans in place that the employees don't care past their $50 or $100 deductible. Why should they care? Why should they change anything? So the system has to come together and has to align. And that's why I say, don't blame the system if you're not helping it. Look at May 17th. This is an article right here in Cincinnati. Diagnosing a price gap. A same procedure, this happened to be a heart procedure, ranges from $26,000 to $51,000 locally. Which one do you want to pay for with your employees? You want to pay for the 51? You think it's that much better care? I don't think so. Take a look at this. I ran a colonoscopy check in Cincinnati. I have the option of paying $7,700 or $1,900. The quality check on both of them were high, which means either one of them is going to come out on top. But if your members of your plan don't know anything about this and don't have choices, how are they supposed to help you save costs? How? Knowledge is power. Well, what is healthcare that works, really? And if you look at the companies that have actually shaved it, and IBM was one of the first to start, it's a direct recognition, self-insured health plan with acceptable financial risk that reduces the member and spouse's claims through integrated well-care development and measurable accountability. Now that's a mouthful, but it is not a wellness program, and it is not wellness light. They don't work. You're wasting your money. If you don't have end-to-end integrated knowledge, and have wellness programs that are tied into and claimed and measure claim outputs, you're wasting your money. You can't prove that your system is affecting your costs. We see it all the time. We've interviewed a lot of companies, both big and small in Cincinnati. I'm telling you that numbers are what, and the proof are what you need to be able to find out what's really working. And are you moving your population? So what's so different? Traditional fully insured or self-insured health plans do not have their member and their spouses' well-care health strategies fully integrated with some kind of outcome-based reporting. They make it optional. Oh yeah, we're going to put in this program, and you can do biometric screening if you choose. You just will not do it, because the people that aren't going to test are people that need to test. And I'll show you more statistics that says, why would you start something that is destined to miserably fail? So, most employer-sponsored plans offer some form of wellness, but they're missing all their population claim reduction potential by not including all plan members and spouses to achieve some kind of level of well care. If they don't have it, I mean, they're basically saying we're going to accept the outcomes with no controls. It's not a plan that works. So here's really, when you think about healthcare and a strategy for companies to embrace around, first is awareness. It's awareness for the executive team. I'm going to show you companies that have full-time wellness directors and the management team doesn't agree on anything. They all have a different opinion of healthcare. Well, you can't really deploy any kind of strategy in a company if you don't have some type of common vision of what you're going to accomplish. And to check the oil on that, which we do, is fascinating. Because you sit in a room and go, well, I don't know how we're going to do this because we don't have agreement. So which opinion do we run after? Second is analytics, that you have the information you can do something with. And last is to measure achievement and to reward it. When employees are making behavioral changes, and so are spouses, reward is the outcome. And what do I get for it? Am I going to get lower premiums? Am I going to get some kind of incentives? What am I going to get? Because behavior is tough to change, as you all know. So a member-centered healthcare plan, and this is the way I'd have you evaluate it. What are they going to do to bring the awareness level up, not just for management team, but what are they going to do with the employees and what the capabilities are? How are they going to change attitude? How are they going to get alignment between what the employer wants and what the employees want? What advocacy support is there? You know, HIPAA doesn't allow employees to walk in and spill their beans on what their health conditions are. They have a lot of questions and they need help. There's got to be some support. And telephonic isn't the only way to do it, because people don't reach out naturally. Support it with analytics and have some achievement to go with it. Well, if you look at anybody in Cincinnati that offers health care, they got all these pieces somewhere. The problem is they're not connected. And so when you're looking for information to determine what you can do and how you can improve, and how's your population developing, and what are the gauges? If you don't have everything connected, you got pods of information, and it's disjointed. And what you want to be able to have is something that's totally coagulated. So that's what ADP did with the baking into their payroll system, the testing. It's the same thing. You bring it all together, and you've got something of which you can make informed decisions by. So here's the question. I'm sure in everyone's billfold or in their purse, they have a card. They have a health card issued by some provider that is special to the employer that you work for. So the question is it working for you? And the answers that I get a lot of times when we ask the question, well, I don't know. Well, what do you mean you don't know? Well, yeah, you go in and you use it and it pays the bill, and I get 15 bills later, and then you just wait a while and it gets sorted out to 5 bills, and finally it gets down to 1 bill, and now I know what I'm supposed to pay and what everybody else paid. And so I guess it's working for me. Well, what's not working about it? Well, it changes every year. I get a different name at the top. First it was I I'm supposed to go to the grocery store for $250. Now it's $500. Now it's going to go to $1,000. Oh, then they put that all back, and then they put this other program in. So we've made healthcare so complex, and we expect employees to understand it. They don't know what to do. So is this card really improving your employees' health? Think about this. If you're an employer, it would logically dictate that the older your employees get, the more claims they're going to have. And you're sitting on top of that bombshell. So you go, well, if I'm the one responsible for paying the bill, and they're getting older, and they're going to have more claims, surely that's a future liability that is emerging that I need to take a look at. Now, we've done studies on age groups and the increases, but I can basically tell you that if you've ever got a 0% increase from your carrier, you actually got an 18% increase, because that's what's happened to the people in your plan on a one-year time frame, where you are not getting after and helping them get better care. So the cost card is a logic. It's a common sense approach. If I'm going to provide health care benefits to my employees, then I have to make an informed decision that says, am I just going to stand back and let this liability evolve? Or am I going to take a position and actually help people? And oh, by the way, when I start helping people, I'm also going to be in alignment with what the hospitals are trying to achieve with well care. And so the way that our country is evolving on health care, I'm doing all I can to do my part. Here's a survey, which, by the way, I put on your desk, or on your table. If you'll fill this out, we will give it back to you very quickly. Well, let me tell you about this survey. To date, we have a few hundred companies on here, and you will find that your answers and the answers of the people that have responded are interesting, because it challenged your thinking on healthcare and healthcare that works, and what's important, and what would make change. I will provide you a comparison of everybody's answers here today against your thoughts, against their thoughts in this report. So that's one. The second thing we'll do is compare it against a universe of companies that we've been collecting now for some time. But in this particular, and so if you want to fill it out and leave it today, or get it to us, we'll do it. The other thing we'll do is we'll give you a model of what I'm going to talk about. But in this particular company, $300 million company, full-time wellness director. Full-time wellness director. There is very little agreement from the CEO to the HR, COO, operations person. You can't see those answers because they didn't come out as well. But the range is 1 to 5. They're all over the place. And the interesting thing is they put out an RFP to improve health care. And I said, well, what's going to be on the RFP? Which strategy, which thought is the one that you're going to put down? Now, they expect to be successful. So in retrospect, if you're a company and you're going to develop a strategy for growth, and you have 5 different opinions of what strategy for growth is going to be, and you're going to put a budget around it, how's that going to work? How effective is it going to be? Well, at the leadership level, there's a lack of transparencies of information, and it's very important that you're able to get it. Well, here's what's happened thus far. Population health results. This is over 35,000 people. This comes out of IHS Interactive Health Resources. Some of the biggest companies in Cincinnati are behind this. They're doing this. They're doing biometric screening. Household names. We're in one today, right here, this company. And they're finding they're changing healthcare in America because they're starting to provide employees information, and they're benchmarking them annually. So it's not just, let's just do it once. It's every year, we're going to start benchmarking blood work. because we can pick up out of 34 panels, we can pick up most of everything we need to get a good start. Now you know, for the first time ever, what you're insuring, because you can get a composite. I mean, think about it. You all have buildings and your businesses, they're so long, so wide, so high, and so much content, you've never had that information on your healthcare plan. Never. And you can have it now. In fact, wellness is a huge piece of where healthcare is going. But well care, not sick care. And well care is preemptive. And the only way you get preemptive is you got to have data. Well, this is what happened so far. If you look at from up to 2011, 2012 was better. The total is 5.9% versus 12% increases, 7.7% reduction in medical spend. 20% lower overall in that time frame. I don't know about you, but I'd like to spend 20% less on my employees' health care. I don't know if your health care plans have done that, but yesterday, Employee Benefit News announced, and it is in Ohio, that they're looking at minimum rate increases for 2014 could exceed 40%. 40%. Why? Because all the carriers are supporting the uninsureds. You need to get on, and why is self-insured plans becoming so hot? Because those carriers that cover your financial risk aren't in the health field. They're not covering the self-insureds. It's like going in and saying, I want the sick policy. Well, it's time for a lot of decisions to be made. So here's the facts. What if I said to you, on average, 58% of your employees have unmanaged health conditions? We can prove that on our research. That's over 70-some thousand people. 58% have unmanaged. 42% will have newly discovered conditions of that 58 when you do blood work. And it's not finger prick. It's serious, detailed blood work. It works. And IHS has been around a long time. Brett, are you here somewhere? Where's Brett? There's Brett. Brett, stand up. He's from IHS out of Chicago. Say hi to Brett. So 23% are likely pre-diabetic, and 2 to 3% will have potentially serious life-threatening diseases. We find a lot of cancer. And when we think about what this means, would you rather, as an employer that's holding the bag, would you rather pay for Lipitor, a stent in the heart, or open heart surgery? Well, I know what I would want to pay for if I'm going to hold the bag, but this is the problem. If half your people have unmanaged conditions, how can you not step up to the plate and say, on our program, to be part of our plan going forward, we're going to have mandatory screening to be on the health plan. You're holding the bag. So if you don't like mandatory word, you think it's Big Brother, you think it's whatever, fine. Pay the bill and watch your health care continue to rise. Because you're not helping the system. The plan in America is to get everybody insured. And if you're going to do your part as an employer, you need to put some teeth into it and hold some accountability. Here's the other thing that it does. When you do it right, your return to work, 11 days sooner. Short-term disabilities less. Your mod rate goes down. Your mod rate goes down by providing better health care to your employees and a level of accountability. You're kidding me. No. All this funnels the same way, and it's all about helping people, your members and spouses, understand, remove the obstacles, and create more transparencies. Awareness. This is what a blood report would look like for someone that we say, know your numbers. And this is ADA compliance. In this particular case, this person had a score of 55 after their blood work. A detailed report was sent to their home. You can get this all over the place. Bottom line was that we expect them to move that number 60% in 1 year. We expect behavior changes to be at least 60% in 1 year. Improve it or pay more. Well, what's the pay more? I don't know, but you can get up to 30% going in the next year. So I don't know what the number is going to be for you, but the carrier world, for the most part, isn't going to help you. This isn't a telephonic reach out. This is where the tires are on the pavement. This is reality for John Q. Smith, that this is your numbers. I will expect you a year from now to change those numbers, or you're going to pay more because you're creating more risk for our company. Very simple. 81% of the participants achieve their goals. And we got a lot of companies we've talked to that go, well, that's too much, it's too heavy, our people won't like it. Yeah, they will. Yeah, you will. Let me find cancer in them and get ahead of it. They will. They'll tell everybody about it. And every company we do, there's always at least one, it seems like, life-saving event that goes around. It was undetected. Undetected. 21, we stopped the smoking, 62% have sugar issues, 88% elevated blood pressure. These are averages. Averages. And it doesn't matter the industry. It doesn't matter. The human being on planet Earth is the same regardless of where they work. They're just not seeing the doctors. And the problem is that they're percolating. So they have to have a place to go. You have to make sure whatever you're going to do for healthcare, you have some friendly portal for them to go to, records all the information about them, so when they go to the doctor's not doing a bunch of litigious stuff to protect their backside. They've got a report they can give them. They got blood work that's not even more than a year old, and other information that hopefully you even have it so that it can be claims-based. And you have data that the doctor can say, well, it's interesting. You're on heart medication. And I prescribed it to you, and you're supposed to be taking it monthly. I'm looking here, I see January's bill. What happened to February and March with your medication? I don't see it in your claims. Well, I didn't take it. Well, why not? Well, because January 1, we start out a new deductible, and I don't have the money to get and pay for it. And you see that all the time. People make grocery buying decisions over health care. And if your system doesn't have any way to help you understand what's going on, then you're going to have claims. So how do you change outcomes? Our recommendation to employers is get a benefit value optimization, some type of fully integrated solution that'll simplify data, that prioritize health risks, recommend specific prevention actions, and allow the employers to manage something rather than just be the receiver. Operate with immediate data. It's interesting. How do you know what's going on if you get a once-a-year report? Or if you get claims reports quarterly even? What does it mean? What's it connected to? What's really going on? Make it easy to understand, and you must agree as a management team. Whatever you're going to do, from the leadership core, we have to have agreement. We got to know what it means so we can talk about it and repeat it often, that it's saying the same thing. Because I will tell you, behavior changes are always looking for an excuse not to continue. And so from a leadership team, if someone says, is this really worth it? And what are we doing and why? And they get the wrong answer, maybe the 6 months that you've just spent working really hard, just start all over again. It happens. So healthcare thinking that works is about strategy. First, it's about awareness and a multi-year strategy, not a one-year strategy. You saw the pricing model, the typical carrier legacy model. Everybody's been working on one-year price fixes. That's out. There isn't one company in America that's changing healthcare outcomes that is operating on one-year price fixes. Not one. And there's thousands of companies that have changed their healthcare outcome. They've reduced their costs. There's companies that have had the same overhead and cost for 3 straight years, some 4. It's doable. But just the simplest thing of knowing what the costs are locally is just one piece. Because if you add that up, that can be a lot. Healthcare collaboration on the C-suite, the financial component has to be measurable. The awareness from HR really puts them in a position that with data, they can do more, and they become part of it. So we provided this survey. I encourage you to get some information. On the on the healthcare front and on trying to change the outcomes, it really is the three choices. You continue to stay the course. By the way, there is no magic bullet in trying to keep your carrier model and say, well, we're really going to get after it. Because you're not. If you're not inside collaborating with your employees and putting something together that provides them constant information, you are going to hold the bag. And if you think there's some magic bullet that says our company can pay $1 million worth of claims, but we're only going to pay $900 in premiums, it doesn't work that way. These big insurance companies have big buildings for a reason. They built in margins, and they built in reserves, and they built in profits. So if you don't get rid of your claims, if you don't reduce your claims, you're going to continue to pay more. You just have to accept it, and it's not going to change. So the survey, if you want, we'll give you a nice report. The other thing is, we've asked on here some information. We'll give you a financial model back to if you like. Healthcare That Works has a number of ingredients that I talked about. And if you apply those ingredients to your company and what your current spend is, you'll see what this impact is over the next 3 years. I will assure you that on the first year, and you're doing awareness on any good plan, on anything that's going to get behavior, don't set your expectations that you're going to knock the cover off the ball the first year. You've been where you've been for a long time. It takes time to get people started, to get them moving and having the support system. But once you get going, you keep the roll going, it'll pay off. It'll pay off handsomely. And over a period of years, your cost increases will be significantly different. I want to thank Rippe Kingston for what they've done to help put this together, especially to Dennis and Patrick Shields. This would not have happened without these guys stepping up to the plate and pulling this team together. And for the other speakers, thank you very much for your time.